This is the contrast and CT scan of abdomen of a 53 years old male patient who presented with progressive dysphagia to the solids. Initially, the endoscopy was done, which showed narrowing of the lower end of esophagus. The endoscope could be barely negotiated into the stomach, and there was a diverticulum. So, a diagnosis of achalasia cardia was suggested. Now, please see the circumferential thickening of wall of the lower end of esophagus. There's a thin walled diverticulum which is projecting towards left side and downwards from the distal end of the esophagus. This is the neck of the esophagus. This is the diverticulum. There is an air fluid level of the contrast medium retained inside it. Now, this is the distal end of the esophagus below the level of the diverticulum. Its wall is also thickened. Upon endoscopy, the upper part of the esophagus was dilated. Unfortunately, since the CT scan has been done for the abdomen and pelvis, so the upper part of the esophagus has not been scanned. So there's a diverticulum involving left lateral wall of the distal end of the esophagus, and there is associated thickening of the wall of the distal end of the esophagus. Apart from the endoscopy findings, this may represent either the recurrent inflammations and the associated thickening of the wall of the esophagus. Since there was no inflammation upon the findings in the endoscopy, so the possibility of achalasia cardia may be considered, although the segment is quite long. This is the coronal scan. Please see the thickening of wall of the lower end of esophagus above the diverticulum as well as below the diverticulum, almost up to the gastroesophageal junction. This is the diverticulum here. This is its neck.